Hello everyone, I'm Dr. Teena Desai, Fertility Consultant, Progenesis IVF Center, Andheri, Mumbai. What is IVF? Let us simplify this today. To understand IVF, let us first understand what is infertility. Now, fertility is the ability of a couple to conceive. Hence, infertility is the inability of a couple to conceive after 1 year of unprotected intercourse. In cases where the age of the woman is about 35 years of age, then it is less than 6 months of unprotected intercourse. Now, about 80% of couples are able to conceive naturally in 1 year without any medical help. The rest 20% are infertile because of various reasons. Let us look into the causes of infertility. So, about 30 to 40% cases are because of a female factor, which can be due to either tubal blockage or non-functioning tubes or defects in ovulation or even certain medical disorders in the womb. About 30% cases are because of a male factor infertility. 10% cases result from a combination of male and female factors, and 25% are unexplained. What is IVF? So IVF is a short form of in vitro fertilization. Now this in layman term is what is called as test tube baby. Here the fertilization of the female egg and the male sperm is brought about outside the body of the woman in a laboratory. IVF provides a way for couples to conceive who are unable to do so naturally or with basic fertility treatments. In certain severe cases like blocked tubes or non-functioning unhealthy tubes, severe male factor infertility, endometriosis, or advanced age of the woman, IVF comes up as the primary treatment modality for infertility. Now let us look into the various steps of IVF. The first step is a detailed history of male and female partner. Now this is very important because it gives us many cues into the underlying causes which might be contributing to infertility. The second step is a thorough evaluation of male and female partner. This usually comprises of a detailed semen analysis for the male partner and a thorough pelvic ultrasound with 3D and Doppler study for the female partner. Apart from this, various blood tests are conducted on both the partners to evaluate their physical fitness. The next part is ovarian stimulation. Here, the patient is given injections daily from second or third day of her period to make all the eggs in her ovary grow. The aim in IVF is to grow as many eggs as possible. These injections are given for about 10 or 12 days, and the response to the injections is monitored by regular ultrasound examination. The next step is egg retrieval or ovum pickup. Now, when most of the eggs have grown and matured, a procedure called egg pickup is done. For this, the patient is admitted in the IVF center for a couple of hours, and this procedure is done under a short general anesthesia. The procedure in itself lasts for about 5 or 10 minutes, wherein a needle is inserted from the vagina of the woman to retrieve all the eggs from both the ovaries. After this procedure, the patient can rest for a couple of hours in the center and go home in the evening walking. Now, because this involves the use of a needle, there are no cuts or no sutures that she experiences. After this, the eggs that are retrieved are assessed for their quality. The next step is sperm retrieval. For this, the male partner is required to give his semen sample by masturbation. In some severe cases of male infertility, surgical sperm retrieval may have to be done. The retrieved sperms are then assessed for their quality under a microscope, and the best sperms are selected for IVF. The next step is the most important step in IVF, that is fertilization. Now, fertilization basically means the union of female egg and male sperm. The traditional conventional IVF utilizes a method in which the egg is placed with a few lakh sperms in a dish to fertilize on its own. This method has been largely replaced by various advanced techniques of fertilization like ICSI, which is intracytoplasmic sperm injection, IMSI, which is intracytoplasmic sperm injection of morphologically selected sperms, or PICSI, which is intracytoplasmic injection of physiologically selected sperms. Now in ICSI, what is done is one good sperm is injected directly into the female egg and the egg is fertilized. Then the fertilized egg is kept in an incubator in the IVF lab to grow for about 3 to 5 days. After fertilization, 16 to 18 hours later, these fertilized eggs are checked for assessing their fertilization, and about 5 days later, the embryos are checked under a microscope for their grading, for their quality. And the best embryos are then transferred into the uterus of the woman if a fresh embryo transfer is planned, or they are frozen in case a frozen embryo transfer is the plan. The next step is embryo transfer. That is, the embryo which is formed in the lab is put into the uterus of the woman. Now there are two types of embryo transfer. One is the fresh transfer or the frozen transfer. Fresh transfer is when the embryos are put into the uterus in the same cycle as the egg retrieval, that is 3 to 5 days after the egg retrieval. Frozen embryo transfer is when the embryos that are formed are frozen to be preserved and they are transferred into the uterus in the next menstrual cycle. Now, whether to do a fresh transfer or a frozen transfer is a decision that largely depends on your healthcare provider and also on a lot of patient factors like the number of eggs retrieved at the time of oocyte pickup, the endometrial lining, the thickness, the pattern and the blood flows to the endometrium. After the embryo transfer, the patient is discharged in a couple of hours. She is given certain medications for pregnancy support. After 15 or 17 days, a blood test is done to confirm if she has conceived. Once the blood test is positive, then some of the medications are continued up to the first 3 months of pregnancy. After the 3 months, the pregnancy care and maintenance is like any other pregnancy which is naturally conceived. IVF, if done following all these steps in the correct manner, is sure to give success to most of the couples. Now, as the saying goes that one shoe does not fit all, in the same way, IVF treatment done in the same fashion for each and every patient is not going to be beneficial. What works for one may not work for another. Hence, individualization of treatment protocols with highly personalized care is the key to achieving IVF success. IVF done with individualized approach in a technologically advanced center with a world-class lab is sure to give success to most of the couples struggling with infertility. If you have any questions, please drop them in the comment box. Thank you.